In August last year, Uganda reported a polio outbreak which the government responded to by kicking off a 3-day nationwide polio immunization exercise targeting over 8.8 million children under the age of 5 years, which started on Friday last week. However, at the end of the 3 days, the target was not met as proposed, which led to a 3 days increment to boost immunization. According to the Ministry of Health, at the end of the 3 days, they still had not achieved the target of 8.7 million.
And to vaccinate 8.7 million Ugandan children below 5 years. And this target, as of the 3 days ending, we had only been able to reach 76.9, which is about 77%, meaning we are still short of our target. On day one, we vaccinated 3.36 million, and the numbers kept dropping.
Dr. Daniel Chabayinze says the additional 3 days will help them complete the exercise.
We have 3 more days starting today to continue for 3 more days, and then we do a mop-up in those areas and we will have achieved our target. So the plan is 2 approach. We do a campaign for 3 days in the whole district, or we do a campaign using what we call staggered approach. You do half the district or a portion you can finish, then the next 3 days you shift all the attention to the next phase of the district.
Dr. Chabayinze says the hindrance to achieve the immunization target was by head teachers and parents that denied children a chance to be vaccinated, which will be punished as an offense for children belonging to the government.
So the children in the country, the government has a responsibility for all the children in Uganda. So a parent cannot refuse to bring a child for a public health intervention for the safety of the children. So you cannot refuse, and we shall invoke the law if the parent refuses. All the children.
Chabayinze says Uganda was declared a polio-free country, but the infections could be a result of neighboring countries, which calls for continued immunization.
It was already set to be polio-free, and we already achieved our milestones. For the last 6 years, we've not had a polio case confirmed in our country. But there are cases confirmed in the neighboring countries like Sudan, Khartoum, in a region, and also in Congo. That puts us on alert, and every time we keep looking at the sewage and the environmental assessment, should we see any circulating wild polio in the sewage system, we declare an outbreak and we vaccinate everybody.
The door-to-door immunization was a strategy to keep children safer amid the polio outbreak in the country, which forced the ministry to take an objective to have all the children below 5 years immunized. Lucky Atare Binjira, CTV, PM Edition.